MBT as a treatment, we found its effectiveness doesn't depend on age. So age doesn't interfere really, that we can tell. And people are using MBT with the elderly now as well, and so on, and with adolescents and with children. So MBT is implemented by different groups who are doing research as well across the age range, and I don't think there's an age dependency. So older people can change their capacities of mentalizing as well as younger people, and so on. But the treatment itself needs to be modified depending on the age group. So children and adolescents need a different sort of format or tasks or in the intervention, but there's still the core focus is still on improving mentalizing stability, right? Because whenever MBT is used, you're really targeting a population of patients where the mentalizing is vulnerable to being lost. It doesn't function as well generally, possibly, but when it's lost, these individuals find it hard to get it back. Okay, so it doesn't get back to normal very quickly, so they can't get back their composure very easily, and they're also vulnerable to losing it in a much wider range of circumstances than other people. The different personality disorders, because they're often divided into groups, vary in where the mentalizing problem is. So we do alter the treatment a little bit depending on what the mentalizing vulnerability is, because we can define it more specifically for different groups. Okay, so we define it a bit differently for borderline personality disorder and antisocial personality disorder. So they're not quite the same in mentalizing difficulties, so we target the treatment differently, so it does change. The other thing, though, is interesting in your question is that would it fit all disorders? Because in all mental health disorders, you can imagine there might be mentalizing problems, you know, because your brain isn't functioning as well as it might and your mind isn't functioning as well as it might. And if mentalizing is a high level function, it's likely to be impaired in schizophrenia, in depression, and so on. And that's certainly true. If you look at the mentalizing in schizophrenia, depression, other disorders, it is changed, it's reduced, or it's ineffective, or it's too focused, and all sorts of things. But that doesn't mean MBT would be a good treatment for them, necessarily, because the cause of their mentalizing problems may be quite different from personality disorder and less trapped in attachment processes and so on. It's not one treatment fits all by any stretch. Yeah, it's a great question, because whether someone's getting better, I mean, if I'm, there's a difference between who you ask. If we ask a patient, they say, no, I'm not, yes, I am. They do a self-judgment. And it's a great idea to ask patients, are you getting better? Are you not getting better? If so, you say yes, in what way, and define it. So you're getting patients to give their experience of what they're wanting and wanting how they're getting better is a valid thing to do. We don't do enough of it, by the way. We're always busily using our own outcome measures, even if the patient thinks they're of no importance whatsoever. We say, oh, look, you're doing really well. You say, yeah, but that's not important to me. You say, oh, but it's gone down, you know. Yeah, but it's not important to me. Okay, so with MBT, we've always tried to do both in a way. But we used quite a range of outcome measures. So we looked at their relational functioning, you know, how they function in intimate relationships and in the world with other people, for example. We also looked at symptoms. How anxious were they? Could they manage their anxiety? How impulsive were they? Could they manage their impulses? Do they change? Do they go down? And we, of course, looked at major behaviours like suicide attempts, where people despair so much and experience such hopelessness they want to die. So we did look at those, all of which show improvement. The other thing that is interesting is that we've found in MBT, we've got the longest follow-up of a treated group of patients with a comparison group of treated patients. And the MBT patients, over a period of 8 years, actually continue their improvement. So once they've improved, they continue it. Okay, and the differences between them and the other treated patients also are maintained over that time. Okay, and we're about to publish some more data on this. So once you get better, you tend to stay better, which is great.